Welcome to this learning resource on animal welfare brought to you by the World Small Animal Veterinary Association. The course consists of two modules, and the first introductory module, is the science of animal welfare for companion animal veterinarians. At the end of this first module, you will have improved your knowledge of the scientific concepts and some of the definitions of animal welfare. You will be able to describe the concepts of animal welfare science and ethics, and you will be able to apply this knowledge using frameworks into your daily companion animal practice. This first introductory module has three sections or parts. This first part will present some scientific definitions and concepts of animal welfare. We will explain welfare assessment and the 5 freedoms, including how to apply the 5 freedoms, discuss adaptation and homeostasis, welfare inputs and outputs, and behavioural and physiological measures of animal welfare. We will finish this section by looking at animal behaviour and welfare. Let's begin by reviewing what is actually meant by animal welfare. There are many different ideas and opinions on how humans should treat animals, and animal welfare is understood in many different ways. A common historical view has been that if an animal is healthy, its welfare must be good. As veterinarians, we are obviously concerned about the effect our treatment has on animals' health and the effect it has on their lives. However, is it possible for an animal to be healthy but still not have a good life experience? Upon graduation, veterinarians are often required to take a professional oath or declaration, partly as a requirement of licensure, but also as an acceptance of the profession's ethics. Here we have the WSAVA Veterinary Oath that was first unveiled during the WSAVA Congress in Cape Town in 2014. It reads, "As a global veterinarian, I will use my knowledge and skills for the benefit of our society through the protection of animal welfare and health, the prevention and relief of animal suffering, and the promotion of One Health." As veterinarians, our work has a direct impact on animals and their welfare. Although the primary focus of veterinary work usually takes the form of direct medical or surgical treatment of animals, veterinarians, because of our knowledge and understanding of animal welfare science and ethics, are in a position to directly improve animal welfare and increase awareness of animal welfare through communication with clients and the society at large. Most scientists and ethicists agree that there are 3 areas to be considered when assessing animal welfare. The first area is very familiar to us as veterinarians, the physical component, including the animal's physiology. For example, an impaired growth rate or mild early disease can lead to detectable physical problems for the animal without causing any overt mental or emotional issues. This area is often referred to as physical functioning. When an animal is not physically functioning normally, the owners will often seek veterinary advice to discover the reason and how to correct it. The second area overlaps heavily with the first and concerns the animal's mental state, including its preferences and feelings. As veterinarians, we are familiar with an animal's feelings as they relate to health and how we can make unwell animals feel better. For example, we have drugs to treat pain and nausea. However, there are other feelings that an animal would choose to avoid without there being any disease or production problem present. For example, the feelings of fear or anxiety during handling or restraint. These may not necessarily be associated with any physical abnormality. Owners often have not noticed that their animals have these feelings or have mistaken them for behavioural problems, so have not asked us to advise on them, and veterinary medicine has historically not overly concerned itself with them. We can distinguish between welfare affecting the physical or mental state of animals. However, most clinical diseases and injuries cause both physical damage to the body and some degree of mental pain or discomfort. The third area also overlaps with the other two, especially with the mental state of the animal. It concerns an animal's species-typical behavior, for example, cat scratching, horses pair bonding to groom, and its environment, whether it is kept in a sort of natural environment to which it is adapted. This naturalness area of animal welfare has not been a traditional part of veterinary medicine, as often it is not an obvious cause of ill health. If an animal is kept in a way that does not allow it to express any important behaviours, the animal can develop abnormal counter behaviours and may suffer from frustration and other negative emotions as a result. Furthermore, restrictions on behaviour and environment may lead to physical effects which are sometimes severe. So we can see that these three areas of animal welfare overlap with each other to varying degrees. Any significant compromise in one area of animal welfare will tend to affect the other two areas. For example, if a dog is housed in a kennel on his own and has food, water, a comfortable resting area, access to a small outside kennel, and is able to go to a larger exercise area daily, his physical functioning is likely to be good. His mental state is also likely to be good, although there may be frustration due to the lack of social interaction. Some people would have concerns for his welfare because keeping a dog in a kennel is not natural. Kennels may actually impact on other areas of welfare, including health. E.g., if an animal is frustrated, then it may self-mutilate or perform stereotypical behaviours which can result in physical damage. Social isolation from other dogs and humans may cause anxiety. So in this example, the dog's welfare may be affected in terms of all three of the naturalness, physical, and mental areas of welfare. These three areas of welfare should not be looked at in isolation, and we should focus on the centre of the diagram where they all overlap. It requires a broad brush or holistic approach to welfare, incorporating all three and understanding the relationship between the areas. Animal welfare is a complex concept, and many people, including animal scientists, may not agree on an animal's welfare state because they place different values on the three areas of welfare. We will now very briefly look at some early scientific definitions of animal welfare. The earliest definitions of animal welfare were concerned with the physical only, particularly how an animal might cope with stress physiologically. McGlone proposed in 1993 that welfare is only poor when survival or reproduction is impaired by physiological issues. However, other scientists argued for mental states, notably Professor Ian Duncan, who proposed that welfare is dependent upon what animals feel. More recently, researchers, veterinarians, owners and others have acknowledged that the absence of negative feelings does not necessarily mean an animal's welfare is good. For good welfare, it is important to have positive feelings such as safety, satisfaction, and happiness. Behavioral studies and research in neurobiology using techniques such as brain imaging are beginning to indicate when animals experience positive feelings and how much the opportunity to experience positive feelings matters to animals. However, the idea is not that we have to prevent animals from ever having any negative feelings. That is unrealistic and unnatural. Negative feelings have adaptive value because they motivate the animal to avoid or escape from harmful situations. Rather, the goal is not to keep animals in such a way that they experience only negative feelings and cannot remove themselves from that situation or adapt to it. Another definition, more related to the ability to perform natural behaviour, was proposed by the American ethicist Professor Bernie Rollin. He noted that animals have an inherent nature, in Greek telos, or genetic traits manifest in breed and temperament, and that he argues to have good welfare, animals need to be able to fulfill their nature. Related to mental states and aspects of naturalness is the idea that animals need to perform certain highly motivated behaviours that are typical for their species. These are evolutionary behaviours that would have developed to enable them to obtain essential resources and therefore to survive. It is generally understood that if animals do not live in an environment that permits these behaviours, they are likely to experience negative emotions and so to suffer. This has given rise to the idea that animals have behavioural needs and that being in an environment that enables animals to express these behaviours can be a source of positive emotion. One of the definitions of animal welfare is from the World Organization for Animal Health, or OIE, representing some 180 countries and territories. The OIE's statement regarding animal welfare stresses the importance of scientific evidence. It says, animal welfare means how an animal is coping with the conditions in which it lives. An animal is in a good state of welfare if, as indicated by scientific evidence, he or she is healthy, comfortable, well nourished, safe, able to express innate behaviour, and if he or she is not suffering from unpleasant states such as pain, fear and distress. Good animal welfare requires disease prevention and veterinary treatment, appropriate shelter, management, nutrition, humane handling and humane slaughter and killing. This definition covers all three aspects of animal welfare. First, functioning, the physical, as it uses terms such as coping, healthy, disease prevention and nutrition. Second, mental, feelings, as it mentioned words such as comfortable, safe, not suffering from unpleasant states. And third, aspects of naturalness, the ability to express innate behaviour. Another statement combining the various components of animal welfare is the 5 freedoms. The 5 freedoms were based on the recommendations in the Bramble Report published in the United Kingdom in 1965. In the 1960s, there had been widespread public concern about animals used in intensive farming systems. The UK government set up an investigative committee of scientists under Professor Roger Bramble, and the committee's report, amongst other things, recommended that animals should have the freedom to stand up, lie down, turn around, groom themselves and stretch their limbs. These became known as Bramble's 5 freedoms. These were further adapted and expanded by the Farm Animal Welfare Advisory Committee, now the Farm Animal Welfare Council, into the more recognisable list known simply as the 5 freedoms. These freedoms are freedom from hunger and thirst, freedom from discomfort, thermal and physical, freedom from pain, injury and disease, freedom to express normal behaviour, and the freedom from fear and distress. The 5 freedoms overlap with the 3 aspects of welfare: physical, mental and naturalness. For example, to achieve functioning, we need freedom from injury and disease, freedom from hunger and thirst, freedom from thermal discomfort, freedom from fear and distress, and so on. As veterinarians, it is our professional obligation to ensure the health and welfare of animals committed to our care. In order to fulfill this obligation, we must be aware of problems affecting the patients that are in our capacity and ability to address. By using the 5 freedoms, we should be able to identify opportunities to address the welfare needs in cases we encounter daily. All veterinarians also need to be aware of the possible harm that our treatments can cause through medical errors, inevitable treatment risks, or unavoidable effects or side effects of any therapy. Most importantly, veterinarians need to make accurate treatment decisions that will maximise the animal's well-being and health and minimise potential iatrogenic welfare issues. However, the 5 freedoms are ideal states and are extremely difficult to achieve, and indeed some of the freedoms are in conflict. For example, to be free of disease sometimes will require treatment, and this can induce fear during handling and restraint. For example, to allow an animal to express normal behaviour may cause distress on certain occasions during normal social interactions. Additionally, the 5 freedoms list emphasises avoiding negative experiences, i.e. there are 4 freedoms from, and the list does not necessarily promote positive experience. For companion animals, it is impossible to fully provide the 5 freedoms at all times, and it may be undesirable to satisfy them fully. For example, if a dog is free to express normal behaviour, the dog should be allowed to roam freely, possibly endangering itself and other animals. This is obviously undesirable. Also, bringing cats to a veterinary hospital may cause distress, but is necessary in order to vaccinate them and keep them free from disease. So with the 5 freedoms, compromise is inevitable. We have an ethical dilemma. To minimise the issue of compromise, modifications of the 5 freedoms were introduced in the UK Animal Welfare Act of 2006. These were called the 5 animal needs. The first need is the need to be protected from pain, suffering, injury and disease. Treating medical and surgical conditions of animals is a core pillar of veterinary practice. And one of the most basic conditions that needs to be recognised is pain. It is important for a veterinarian to know how and be able to assess whether an animal is experiencing pain through the power of observation. By observing behaviours such as vocalisation and trembling, as veterinarians we can recognise pain in an animal and should be able to differentiate whether it is a medical or a behavioural problem. The second need, freedom from hunger and thirst, translates into need for a suitable diet, and this can be viewed as a fundamental principle of animal care. Animals that experience prolonged hunger, thirst, dehydration, malnutrition or obesity are overtly viewed as lacking good welfare. As veterinarians, we can assess the nutritional status of a patient and recommend an appropriate diet based on the needs of the animal, as well as encouraging a client to provide adequate exercise opportunities. The need for a suitable environment may be more difficult to assess, as an animal is often not observed directly by the veterinarian in its home. However, during the consultation, the veterinarian may elicit information about the animal's home environment. Veterinarians should advocate providing pets with adequate space, freedom from noise and other disturbances, as these can create negative effects on temperament and behaviour. Providing a quiet and spacious hospital cage or kennel should be considered when the animal is in confinement. The surrender of pets to shelters is often caused by behavioural problems that have developed from environmental welfare issues in the home. Veterinarians can help reduce the likelihood of a pet being surrendered by providing professional advice on behavioural problems as well as the animal's welfare, all the while ensuring that the owner's expectations are realistic. While a suitable environment may be in place, animal welfare can also be compromised by isolation or the presence of other animals or humans. For example, the need for canine or human company in dogs is variable, thus the presence of either should be a source of positive behaviour. It is important for us as veterinarians to give appropriate advice when we recognise human behaviours that may reinforce an animal's aggression towards other humans or animals, or an overdependency on humans. Other behaviours that may be observed are repetitive behaviours, and even physical ones such as vomiting and diarrhoea, all of which can be suggestive of distress, anxiety, or boredom. In addition, clients may be reminded that the presence of other animals can potentially be a source of transmittable diseases, pain, injury, or fear, and should be managed appropriately. The 5 freedoms and needs fully conform here. In dogs, for example, play and environmental interaction are typically indicators of good welfare circumstances. However, when there is an absence of interest in the environment or the presence of abnormal behaviour, such as repetitive behaviours known as stereotypies, this suggests welfare concerns. It may be difficult, but a crucial step towards making an accurate assessment of welfare is to differentiate abnormal repetitive behaviours that are caused by medical conditions rather than anxiety, i.e., feelings of conflict or frustration in an animal's environment. Employing the 5 freedoms and needs depends on the involvement of the animal carer or the animal owner. This will determine whether welfare can be safeguarded. The carer needs to be willing. He or she must want to do the job of caring for the animal and its welfare, which involves factors such as being conscientious, hardworking, compassionate, etc. The carer needs to have the capacity of doing the caring well, and this involves factors such as a physical ability, knowledge, and understanding and experience. And the carer also needs to have the opportunity, which involves having sufficient time and resources and sufficient support systems. As well as the 5 freedoms and the 5 needs, other concepts of animal welfare have been developed over the years. In 1986, Broom proposed that the welfare of an animal is its state as regards its attempts to cope with its environment. Broom mentioned that this state includes how much the animal is having to do to cope, the extent to which it is succeeding in or failing to cope, and its associated feelings. He continues saying that welfare will cover a continuum from very good to very poor, and studies of welfare will be most effective if a wide range of measures is used. A more recent view was proposed by David Meller in 2012, who stated that strategies designed to manipulate the emotional action-oriented systems have the potential to replace the negative emotions generated within those systems with positive ones, and therefore may lift a poor net state of welfare beyond the neutral point to a net positive state. Mellor argued that the early thinking about animal welfare focused mainly on diminishing unpleasant motivational urges or drives, which would only lift a poor net welfare state to a neutral one, whereas promoting positive welfare conditions may lift the net welfare state into a positive one. Recently, Ohl and van der Stee proposed that welfare as a biological function should take into account the dynamics of the individual's adaptive capacity. What they meant is, positive welfare implies that the animal has the freedom and the capacity to react appropriately, i.e. adapt, to both positive and potentially harmful stimuli. Therefore, when assessing animal welfare, it is important to evaluate whether an animal is able to fulfill the demands of the respective environmental circumstances given the limits of the animal's capacity to adapt. In order to evaluate whether an individual can adapt to a stimulus, we must look at the change in response towards a particular stimulus over time. In this diagram, you can see that an animal's welfare may be reduced or impaired even if the limits of adaptability have not yet been exceeded. The environment of evolutionary adaptedness, i.e. the environment to which the species has adapted through natural selection, sets the limits of an individual's capacity to adapt. Also, the limits of adaptability are reached when the environmental demands exceed the regulatory range of allostatic mechanisms, where allostatic means achieving stability through change, which involves changes in physiological and behavioural mechanisms. Many more views and concepts on animal welfare are found in the literature. But how are we able to measure the response of an animal to its environment and to measure animal welfare? In order to know exactly what aspects of animals' experience we might measure in a welfare assessment, it helps to break it down into a sequence, as shown here. Animals get sensory input from their environment. They see, hear, and touch and interact with aspects of their environment and the events around them. As animal owners or carers, we provide animals with resources. For example, we breed them to have a particular genetic makeup. We house them in a certain way. Also, various events happen around our animals. There are regular daily events such as the change from day to night or the arrival of food. Other events will be occasional, such as a visit to the veterinary hospital and a clinical examination. There are also internal events, such as the animal's bladder filling with urine. All these events and resources create ongoing external and internal sensory stimulation for the animal. We cannot easily measure that sensory input. However, we can record the resources that are available to them and many of the events in their environment. Next, the brain evaluates this sensory input in accordance with the animal's experience, genetics, etc. For example, the brain may evaluate the input as novel, e.g. the arrival of a new animal, as a potential threat, e.g. the veterinary examination, as a source of pleasure, for example the approach of another animal for play, or as neutral, for example a car passing by. For example, anxiety on seeing the veterinarian or seeing a new animal, or positive, for example pleasure because of anticipated play. Or there may be no emotion because the sensory input is neutral, for example the sound of the car. The brain's evaluation also gives rise to physical feelings, pain, excitement, and anxiety, for example. The animal's body responds to these feelings both physiologically through, for example, an increased heart rate, and through behavior, and it could be urinating, vomiting, or hiding. Pleasure can also increase the heart rate and cause an animal's behavior to change. He or she may also get up, but will probably approach rather than run away. There is no easy way to measure the emotions and the feelings for an animal welfare assessment. However, we can measure their responses. The final result of this sequence is that the animal can adapt to his environment and learns and thus survive in a very general sense. For example, the animal ignores the car and does not waste energy avoiding it because it has learned it is benign. However, it does expend energy trying to get away from the veterinarian, not knowing that the veterinary diagnosis and treatment may be in fact essential for survival. Of course, it is possible that the animal is unable to adapt despite the attempt of the body to respond. We see that these responses enable the animal to adapt to the initial event as appropriate and therefore to survive. Survival or death rates can be very crude indicators of welfare within a group of animals. However, more accurate and precise measures are measures of the events and the environment, for example handling and housing, which give rise to sensory input known as welfare inputs, and measures from the animals themselves, their physiology and behaviour. The animal's responses to this input are known as welfare outputs. Welfare inputs, the resources that are available to the animal, or resource-based measures, fall into three major categories. Management resources, for example, owner knowledge on species-specific care, how much time is allocated to the care for the animals. Environmental resources, for example, the kind of housing, the quality and the amount of the animal's food, the use of vaccines, etc. Animals resources, for example, the animal's genetic makeup and early experience, which affects disease resistance, fear thresholds, etc. Welfare inputs are relatively easy to measure, especially owner and environmental related ones. However, you cannot know how an animal has experienced its life if you do not also gather data directly about the animal. Consequently, welfare outputs, the animal-centered measures or animal-based measures, must be part of the welfare assessment. There are three major categories of welfare output. Measures of clinical health, for example, lameness, coughing, and other clinical signs. Measures of behaviour, for example, the amount of time an animal sleeps or the presence of abnormal repetitive behaviours. Physiological measures, for example, blood, cortisol, and heart rate. We will now look at the physiological and behavioural measures in more detail. Having a good understanding of an animal's behavioural repertoire provides us with a basis for understanding which specific behaviours are important for the animal. An animal having the opportunity to perform these behaviours, also referred to as its behavioural needs, is an essential requirement for good welfare. It is important to recognise behaviours indicating that the animal is functioning well, feeling well, and able to perform important behaviours, and in contrast, behaviours indicating the animal is not functioning well, not feeling well, and not able to perform important behaviours. This slide briefly shows some behavioural indicators of poor animal welfare that may be observed. There may be limited opportunity to observe the full range of activity of patients at the clinic, but generally, when there is little response to external stimuli, it often points to a lack of environmental stimulation, either due to confinement to a small area or the absence of a variety in external cues. Additionally, pets that have plenty of contacts with humans should not show fear or aggression in normal circumstances. Another example of behaviours that indicate poor welfare concerns are stereotypies. These are repetitive behaviours that may have complex motivations, but they can often be linked to some natural activity that is frustrated in a particular or previous environment, such as pacing in dogs and other abnormal behaviours such as constant licking. An animal's experiences can affect physiological parameters, and we as veterinarians can use these to indirectly measure welfare. Any adverse event or condition, which may be termed as the stressor, can induce both acute and chronic stress responses in the animal depending on the duration of exposure to the adverse event. Although the experience of stress is a natural condition, it becomes a concern when an animal is stressed beyond its ability to cope and later results in the development of disease. An acute stress response can be evaluated by measurements of heart rate, blood pressure, respiratory rate, or by collecting blood samples to quantify catecholamines, glucocorticoids, and ACTH. Animals suffering from acute and chronic pain may display distinctive behaviour, but measuring physiological indicators may allow accurate differentiation of acute or chronic stress responses. Glucocorticoids are eliminated in the urine where they are not subject to acute fluctuations. Accordingly, urine cortisol can provide an index of stress levels over recent hours in many species. Animals relinquished to shelters from homes show increasing urine cortisol levels over time as compared to strays that have more stable hormone levels in the shelter. Evidence from both behavioural and physiological measures can provide better assessments on severity and degree of animal welfare. Most physiological responses are difficult to observe directly. Also, they are largely non-specific. For example, the stress response can occur when an animal experiences positive or negative sensory input. Therefore, measures of the stress response alone do not tell us if the animal is having a positive or negative experience. We saw that as well as measures of physiological outputs, the behavioural responses may also be measured. Having a good understanding of animal behaviour and how it links with welfare is essential for us to be able to use animal behaviour as a measure of welfare. Knowing an animal's behavioural repertoire provides us with a basis for understanding which specific behaviours are important for the animal to perform. Furthermore, having knowledge of not only species-specific behaviour, but having an adequate level of familiarity with the normal behaviour of the individual animal can be important to distinguish aberrant behaviours. Different members of the same species can vary in their behaviour. This may depend in part on their breeding and previous experience. In practice, you may carry out a routine health check examination on two perfectly healthy dogs. However, one dog may generally be calm in nature, while the second dog is highly excitable and alert. In each case, if the owners of each dog can confirm this is normal behaviour for their pet when they visit the clinic, you could then in turn conclude with some confidence that the behaviour you see is normal for each of the dogs, and after a number of visits you would become increasingly familiar with each dog's normal behaviour. If on a particular visit you notice a second behaving in a subdued manner, you'd know this is out of character, and this would signal a possible welfare issue in terms of physical functioning, mental state, or naturalness. What behaviours out of a species' full behavioural repertoire does an animal choose to perform? What is the motivation for performing various behaviours? There is no universally agreed definition of motivation. However, a simple one is the urge to perform a behaviour. This urge results from sensory input to the brain. As we saw earlier, sensory input can be internal or external. When the brain evaluates that sensory input, this can create an emotion and an associated urge to perform a particular behaviour. This result is a measurable behaviour response. The behaviours an animal shows are relatively easy to observe. Also, behaviour represents a more complex level of functioning than physiological responses because animals' behaviours allow them to change and control their environment. For example, run away, build a nest. Therefore, measures of behaviour should tell us something more specific about an animal's experience than physiology alone. So a combination of both measures provides a more reliable assessment. As veterinarians, we are very aware of behaviour assessment associated with physical functioning and feelings. We include them as clinical signs and use them to assist in the diagnosis of disease, the physical functioning aspect of animal welfare, and to identify associated negative feelings such as pain and depression. However, veterinary medicine has not traditionally concerned itself with behaviour in other regards. That is, when advising our clients, we have not traditionally talked about the third area of welfare, i.e., about whether their animals have the opportunities to perform behaviours that are important to them, naturalness. Also, our clinical work has not typically included behavioural measures of how animals feel when they are unable to perform these important behaviours. Partly the reasons these are not discussed are animals may function very well even though they are experiencing negative feelings as a result of being unable to perform important behaviours. Also, their owners are not aware of the broader behavioural aspects of welfare, so they do not typically consult veterinarians about them. However, this is changing as public concern for animal welfare grows, and research shows how important some of these behaviours are to animals, and that not being able to perform them can affect physical functioning and their mental state. To summarise the first part of this module, when defining animal welfare, three components should be considered: physical, mental, and aspects of naturalness. This approach is combined in the 5 freedoms and the 5 animal needs, which may be applicable when thinking about animal welfare in practice. There are many possible scientific definitions and concepts of animal welfare, and animal welfare science is still a relatively new and growing area of scientific endeavour. We have looked at how to assess animal welfare. We have briefly discussed welfare inputs, management, environment and animal resources, and welfare outputs, disease, behaviour and physiological measures. In order to measure animal welfare, a combination of behavioural and physiological measures should be used. The second part of this first module will discuss theories behind animal welfare ethics, including ethical theories and principles. We will apply this information on a practical example of an ethical concern in small animal practice about feline renal failure. But let's start with the theories behind animal welfare ethics. Ethical theories provide the logic and reasoning behind how we should act towards animals. In part 1 of the module, we noted that animal welfare concerns how animals experience their lives in terms of physical functioning, mental state and feelings, and natural behaviours. To understand these three aspects requires science, hence animal welfare science. Animals' experience of their lives is affected by our values, how we think we should treat animals, what we think is important for them. Science helps us understand some of these issues. Ethical theory, however, provides a logical framework to balance that understanding with knowledge of other important factors, such as the need of companion animal owners. By using this framework, we can decide how we should treat animals. Animal welfare legislation reflects the ethical concerns of a society. Legislation may be defined as a law or set of laws suggested by a government and made official by a parliament. Modern laws on animal protection are governed by scientific information about animal welfare and also by ethics, i.e. what the public, the government, animal advocates such as the veterinary profession, retailers and others believe is right or wrong treatment of animals. Depending on those ethics or values, experts and in turn governments may reach different conclusions about what animal protection legislation should permit. This point explains in part why different countries may have very different laws about the same animal protection issue. As veterinarians, we are often the ones that encounter contraventions of animal welfare legislation. However, a veterinary relationship with a client can impact the way that a suspected infringement of animal law is dealt with, and you may feel reluctant to report a client. If you cannot educate the owner to take positive action for an animal, you may need to proceed by discussing the issue with your colleagues and the relevant enforcement body to see what, if any, laws have been breached and what further steps should be taken. As the veterinarian, you are the animal's voice, the animal's advocate. Ethics is a branch of philosophy that deals with morality and human conduct. Various ethical theories provide logical reasons why a certain course of action may be preferred, helping us decide how to act. Each theory helps us look at a particular problem in a slightly different light and broadens and deepens our thinking and challenges our habits. Using ethical theories to reflect on real-life problems can help us come up with a more ethically sound proposal about what we should do. Sometimes the different theories will clash, and this can be useful in pushing us to justify why we might choose to apply one theory over another. Often the best proposal will accommodate aspects of a number of theories. These ethical theories can be broken down into three broad categories: ethics of principle, deontology; ethics of consequence, utilitarianism; and ethics of purpose, teleology. Ethics of principle, or deontology, focus on the rightness or wrongness of actions in and of themselves. It considers the implicit principle or general rule governing an action and tests its validity by seeing if we can apply it as a universal law. Can we be consistent? Could we uphold this rule in similar situations? And if not, is there a morally relevant difference for this? For example, deontology would question why we might treat two very similar animals in similar circumstances in different ways if there is no morally relevant difference between them. Ethics of consequence, or utilitarianism, focuses on the consequences of an act and proposes that the best course of action will be the one that produces the greatest good for the greatest number. Hence, all stakeholders must be identified before we can decide what is good and bad for them. Ethics of purpose, or teleology, focuses on an agent, an individual or a group or an organisation, and decides what is its good purpose, and then asks what particular action can bring about these good purposes. It differs from the previous two theories by concentrating on the agent, e.g. veterinarians, veterinary associations, doing the act and their characteristics rather than the act alone. Ethics of purpose might be partly reflected in the mission statement of an organisation. The four principles of medical ethics described by Beauchamp and Childress are designed to provide medical doctors with a theoretical framework from which to analyse ethical situations in medicine and guide the doctor-patient relationship. There are some similarities but also certain distinct differences between our work in veterinary practice and the work of a human doctor. However, these four principles can still be of use in guiding us. The first principle is beneficence, which requires the doctor to only do the patient good. This is often interpreted as an objective health assessment by the doctor used to advise what is in the best interests of the patient. The second principle is non-maleficence, which is the reverse of beneficence. The principle of, above all, do no harm, as stated in the Hippocratic Oath. A reminder that we can harm by well as help with our interventions. The third principle is justice. Justice is about being fair. Patients in similar situations should normally have access to the same health care. Also, in determining what level of health care should be available for one set of patients, we should take into account the effect of the use of resources on other patients, i.e., we must try to distribute our limited resources fairly. The last principle is the respect for patients' autonomy. Autonomy literally means self-rule. It is the capacity to think, decide, and act on the basis of such thought and decisions freely and independently. It requires doctors to assist patients in coming to their own decisions, for example, by a clear provision of information and respecting the patient's wishes even if they clash with those of the doctor. So what animal welfare and ethical considerations are important to consider in the veterinary practice? Let's look at chronic renal failure in a cat as an example. As we know, chronic renal failure typically has a progressive nature, adversely impacting quality of life in affected cats, which eventually develop clinical symptoms such as anorexia, depression, dehydration, vomition, and inappropriate urination. All of these may become welfare issues that need to be addressed through proper management and treatment options that will not only increase survival time, but also improve the animal's quality of life. If we look at the different treatment options for feline chronic renal failure, these can be influenced by disease severity, compliance of the client, treatment response and financial constraints. However, let's consider the welfare and ethical concerns for each of the four treatment options. Option 1 leans towards letting nature take its course, which raises the welfare issue of letting an animal progressively deteriorate and suffer. The ethical question is, should we allow the disease to progress without providing appropriate treatment to prevent suffering? And will the cat have a life that is worth living? If euthanasia is performed humanely, as in option 2, there will be no welfare concerns. But the ethical issue is euthanasia would deny the cat the opportunity to live out its natural lifespan. As veterinarians, are we able to reliably assess what the future quality of life will be for the cat? In option 3, giving individualised therapy, the veterinarian is addressing the need for an effective results-based approach. This option must also consider the client's financial capabilities. The ethical concern is whether we are inflicting unnecessary suffering on the animal during treatment or evaluation, and whether the treatment option is something that the individual, i.e. the cat patient itself, would want to experience. Lastly, option 4 presents a less specific approach. However, concerns would remain regarding inappetence associated with changes in nutrition, e.g. the palatability of a prescription diet, the development of cachexia, problems associated with the chronic administration of subcutaneous fluids, etc. The ethical question remains, is this treatment option increasing the risk of more suffering? So which of these options takes into consideration most, if not all, welfare and ethical considerations? In this case, treatment option 3 may be the most sensible and humane. Individualised therapy with its own health goals will allow the veterinarian to recommend various treatment approaches that could be targeted against the identified underlying cause, as well as maintaining homeostasis to keep the patient alive and with an improved quality of life. Moreover, it is fair to provide treatment for the patient, allowing it to live with a regular assessment to ensure that pain and suffering is not occurring. Finally, in the terminal stages of feline renal failure, euthanasia, provided that it's performed humanely, may be considered to relieve the animal of pain and suffering. As a veterinarian, you will play an important role in this decision making and deciding when it is time. With the 4 principles of medical ethics, veterinarians can make better management and treatment decisions in cases being handled with consideration of both animal welfare and ethics in practice. If you are interested in ethics, there are free downloads available in the Everyday Ethics section of the British Veterinary Association's In Practice website. In summary, Part 2 briefly considered ethics and ethical theories, which involve the logic and reasoning on how we should act towards animals. Ethical concerns of any society are reflected in animal welfare legislation, and different societies have different ethical considerations, and so different countries have different laws. We have also reviewed the 4 principles of medical ethics from Beauchamp and Childress, which involve doing good, avoiding harm, being fair, and respecting autonomy by thinking about what the patient would choose. And lastly, we have looked at a practical example of feline renal failure where we took into consideration welfare and ethical concerns. Part 3 will discuss the role of veterinarians and animal shelters in population management, including responsible pet ownership and trap, neuter and release programs. We will finish this section with some information on veterinary disaster management and client education in companion animal practice. It is important that the roles and functions of an animal shelter are clear. These could include holding lost pets to be collected by their owners, rehoming of surrendered or stray animals, neutering of all animals and possibly the neuter and release of some strays. Veterinarians are natural resource persons who may actively engage in animal welfare activities on a daily basis. If working or volunteering in animal shelters, you may have to act as a risk analyst and decision maker in the development of guidelines and protocols within the shelter. As a veterinarian, you can help them make informed decisions so that the shelter's work will benefit animals and not, ultimately, make their welfare worse. For example, you can ensure that surgeries, typically sterilisation procedures, are done with adequate analgesia and anaesthesia, ensuring freedom from pain of suffering peri and post-operatively. Shelters may desire to implement a no-kill policy, but if the 5 freedoms or the 5 needs are compromised, veterinarians should be able to recognise and accept the practical reality that not all animals can be rehomed or kept and maintained in good condition. When a no-kill policy is likely to cause unnecessary suffering, selective euthanasia in shelters should be advised. Although difficult, these decisions may ensure that the 5 freedoms and needs are met and more animals can remain healthy and with a better quality of life. Differentiating between owned and unowned animals is an important consideration for animal shelters. As veterinarians, we can promote responsible pet ownership by encouraging clients to have their pets permanently identified, typically through the implantation of a microchip. Part of your advocacy may already include sterilisation or neutering of animals. Neutering is generally accepted practice in population control, with its advantages outweighing its disadvantages. While we as veterinarians should promote the positive effects of sterilisation, such as health benefits and contribution to population control, it is also important to discuss with owners the negative effects or risks. These include preventing the animal from exhibiting natural behaviour, the infliction of pain and stress during the surgical intervention, and the predisposition of the animal to gain weight, especially in female dogs and male cats. Dog and cat population management is frequently a contentious animal welfare issue. Control methods have included culling, relocation, and more recently a trap neuter return (TNR) program. The TNR method is described as the humane capture of animals for sterilisation and or medical treatment, followed by the release of animals to the site where they were caught. It is considered the most humane, effective and financially sustainable strategy for controlling free roaming cat populations. Scientific research supports the success of TNR in reducing cat populations. However, TNR can only be a useful tool if it is part of a comprehensive program with other components such as education, if the resources are adequate to neuter at a faster rate than the reproductive rate, if the community generally accepts roaming animals, if all the relevant stakeholders agree to it, and if the skills and competencies of the trap neuter release program are adequate. More information on trap neuter release is available on the International Companion Animal Management Coalition (ICAM) website. Briefly on veterinary disaster management. It is the professional duty of veterinarians to care for animals in need and to protect the public from potential zoonotic diseases. Veterinarians can make major contributions in their communities by taking on the following roles. Veterinary emergency response units, animal response teams, assist during disasters and are utilised in disaster-hit communities where both livestock and companion animals may be injured, sick, or are suffering from hunger and dehydration. Veterinarians can also be involved in community-based projects and the formulation of national planning and laws which include animals. As veterinarians, we are also ideally placed to provide training, lectures and demonstrations to the public. In your practice, advising owners on tagging, providing cat carriers and having a preparedness plan should not be overlooked, especially in disaster-prone areas. Your own clinic or hospital should also have a preparedness plan that in future may secure your practice as well as to help animals in need. The following online training modules are available if you wish to know more about veterinary disaster management. This is from the US Department of Agriculture and World Animal Protection, a course for veterinary emergency response units. This brings to a close the first module on the science of animal welfare. We hope that you were able to gain some insight on your role as an advocate for animal welfare. In every case that you encounter in practice, there is an opportunity to promote animal welfare. As veterinarians, we should be encouraged to motivate our clients to provide the best possible care for their pets and to help consumers make informed choices that impact positively on animal welfare. Communication skills play an important role, and effective communication between veterinarians, hospital staff and clients, your practice can improve compliance, increase satisfaction levels and improve patient outcomes while tackling animal welfare issues. To conclude, in Part 3, we looked at the role of veterinarians and animal shelters in population control, including neutering and trap-neuter return procedures, and how veterinarians can promote responsible pet ownership. We have also briefly looked at veterinary disaster management to describe your role as a veterinarian during disasters. Thank you for your participation in this first module on the science of animal welfare. We hope that you have realised that welfare issues are an everyday consideration for companion animal practitioners.